Can all the emptiness get haired in hair transplantation? Closing an empty area is not our basic aim. In hair transplantation, our target is to make our patients to have natural hair that they can brush easily, not to have frequent haired head, and to close an empty area. If our aim to close, we can make it on a patient who has four-fingered hair on the nape and has a wide non-haired area. Of course, it is important to understand the patient's expectation. In these kinds of situations, we see that the hair is so artificial. Hair. Our basic principle is to calculate the capacity on the nape and degree of the patient's non-haired area. 3,000 grafts can be implanted on a patient's head according to the capacity of the nape and can be reached to middle frequencies. Frequent 5,000 grafts is implemented and retained to vary while frequent hair. The basic question in here is what is the patient's capacity and what is his or her expectation? And there is an extra situation about the patients. It is a must not to receive so much grafts from young people. If you take more than you need, the person probably will lose his or her own hair on middle ages, then there will be no hair on the head. So we must leave some hair in the nape. Maybe they will use for another transplantation. Naturally, we never try to close a space in hair implant. The hair must be so natural to brush and look. I have to point out that the hair will not be so frequent or not absolutely. Because we have to implant the hair in order to get a vision of natural hair. If the implant done in more frequent, the look will be thinner. When the patients see their results, the implant would be weak according to their expectations. It's better to choose not to do anything hair implant than trying it.